from our clinics. Okay. It's okay. This is one thing that we learned from our own health clinics, that the number of people with hypertension is extremely on the rise. And this is because people are eating processed food, canned food, and the amount of stress that they're dealing with is unbelievable. So the number of non-communicable diseases is actually on the rise. With that, people's ability to fight this is decreased, because what we've also found is that an average of every Palestinian in Gaza has lost an average of at least 12% of their body weight since the beginning of the war. And that means 10 to 12 kilos for an adult, 6 to 7 kilos for a child. So we're looking at really some stark numbers. Next slide, please. So one of the things that ANERA has been doing since way before the war was we would bring in gifts in kind or product donations. We had a product donation program that we put in place. We'd bring medical donations, medical aid, and we've been doing this for quite some time. For this war, we did this. We started very similarly, and if you can see the number of pallets distributed and delivered to Gaza, there is a slow start from November to January. This was because a lot of the routes that we were working on was Egypt. It was unknown. People had no idea how the route was, how to navigate it, how to work with Egyptian Red Crescent, with local organizations. And then we had a spike in January, March, and May, and then it tapered down because in May, the Rafah border closed. And so we have not been able to get medical essential supplies to Gaza since that time. The other slide, as you can see, is the number of treatments that we've given, which coincides with the number of the pallets that we've been able to bring in. One thing that I would like to say is that since October 7th and through September 3rd, this has totaled about 7 million treatments that we have done. We work with about 26 partners, local partners, as well as the different clinics that I mentioned. Next slide, please. Okay, so let me start with some of the challenges here. And the challenges that I'm going to be talking about are strictly focused on logistics and operation, and not focused on the safety of the people delivering this medicine or dealing with these logistics, or that humanitarians themselves are suffering. Our staff have been displaced at the very least 6 or 7 times each. They've had their shelters shot at. We've lost one of our own employees on March 8th who was killed in a strike. We recently had an incident with where our lead convoy in a convoy that was going to the Emirati hospital carrying food, medicine, and supplies was bombed, and the lead vehicle with the 4 security people in it were killed. So these are just the challenges that we face on logistics and operations. So one of the first things that we face was really trying to figure out how to do it. So we have figured out there's 3 basic routes that you can work on. You can work on the Egyptian route, the Jordanian route, and the Israeli route. So the Egyptian route was one that we used in the beginning. And like I said, it was very challenging because it was unfamiliar. We didn't have any prior experience in it, but all the organizations were really focused on this route because it was the one that was recommended. It was the one that was easiest in terms of access, because that was the opening of the Rafah crossing, and the other crossings, Erez, Zakim, Kerem Shalom, were not just opened yet. So the second route, the first route was really working and functioning up until May. The second route was the Jordanian route. This was a faster route, and we partnered with JACO, who you'll be hearing from also today, who helped and supported us in getting our things in, as well as the logistics cluster. This was a bit quicker. We were able to collaborate with other UN agencies to bring in our medicine and supplies, and basically had faster deliveries up until probably again in May, and I'll explain a little bit why in a little bit. And the last route is recently opened, is the Israeli route. They have been, Israel has been encouraging organizations to procure locally from West Bank and Israel, and then bring them in through the Israeli route. So bring it in through the Israeli route through Zakim and Erez. Yeah, so one of the things that we have as a challenge is also that there's fewer flights to Israel going through custom clearances through Israel, and the rising aircraft cars are limiting our aid capacity to bring it in through that route. So the recommendation here is to do to constant changes. We need to continue to monitor the situation and be flexible and pre-position across all routes to mitigate delays and congestions. There's a need with flexibility with the stakeholders and advocate for streamlined and less complicated procedures across all routes. Next slide, please. So the authority customs approvals, they're lengthy, they're complicated, they're in a different language most of the time. So a lot of the times we are working with custom clearance with Israel that do not speak English. They speak Hebrew. We have to navigate through that and try to find a way that we can send the request. Coordinating with COGAT. COGAT is the office, the coordination of the government of Israel for the occupied territories. We coordinate with them to bring our things in and get them approved, and the authorities in Egypt and Jordan. All this just slows everything down. Every time you want to try to coordinate and bring things in is just another challenge, another process, and it's a very lengthy process. The recommendation is to build stronger relationships, maintain clear and constant communication channels, and implement pre-clearance of documents and maintain constant communication. It's easier said than done. On paper, it looks really pretty, but in actuality, it's quite challenging. Next slide, please. Oh, no, other slide. There you go. So the safety security route challenge. So we've had challenges with settler violence, attacks on aid trucks, the unpredictability of the routes, the gangs that are stopping and looting, the actual looting, which to me is not as bad as the gangs, because the looting you chalk up to self-distribution. People are getting the medicine, that's fine. The problem of looting and having these mafias stop the trucks is that they take the supplies and then they sell them on the parallel market, which is not helpful for anybody. We also have closures. We have to deal with closures constantly. We can have a coordination. We actually had a coordination to send in some of our meat to go in on Sunday. Then that coordination was changed due to operational technical challenges, and now we're rerouting and trying to get it in the next 2 days. So there's always constant trouble with the coordination. The high transportation costs, again, going back to numbers. So a truck coming in from Jordan to reach one of these ports, each truck is about $3,000. To get the truck that's coming in, that's carrying 22 pallets, 22 tons of any kind of supply, taking that truck and getting it from whatever border that you go to into Gaza is an additional $2,500, $3,000. So you're looking at about $5,500 per truck for each, just to bring in and distribute. So it's actually very costly. It's a strain on resources. The capacity to bring them in is quite a challenge. Next slide. So bureaucratic hurdles, delays, crossing multiple stakeholder coordination issues. So much paperwork, so many things that we have to submit, so many things that we have to try to get approvals on. If we get an approval from COGAT, then we need approval from our partner, whether it's the WFP or JACO. They have to abide by their approval process and get those. So it's a back and forth communication, trying to make sure that we're getting all the information that is needed to the partners. There's the delays at the crossing points due to the inspections. What people don't realize that these trucks usually go from 3 back-to-back transfers. So the first one is, say, we're taking the Jordan route. They will load up the trucks in Jordan, then they will go into Israeli border. They'll take everything down from the trucks, put it in a different truck, and sometimes you have problems with palletization. You have to repalletize, things get lost. Your own goods could get lost because the signage gets taken off. Then it's taken into to the port, whatever port that you are reaching, and from there it's another back-to-back process where they take it to trucks. Those trucks in Gaza are much smaller than the trucks that are coming in. Average trucks that are coming in from the outside take about 22 pallets. In Gaza, it's 12 to 14 pallets. So we really need to establish a coordination team to streamline all these different hurdles and reduce paperwork and try to support us in getting things as quickly as possible. I have 2 minutes. Okay, so I want to go to, if you go to slide 8, actually, and I hope that this could be shared with everybody because there really is a lot of information that you could use. There's next slide. I want to go to the recommendations. So this is the slide that I want to just focus on right now in my last 2 minutes. So one, I think it goes without saying, but we have to keep saying it. We have to keep saying an immediate ceasefire, an end to the occupation, access of humanitarian aid, flowing humanitarian aid into Gaza is a need, is a must. We just need to keep saying that. That's our number one recommendation. We need to advocate for safer routes for aid delivery, ensuring fair and equitable distribution. We need to ensure that there's consistent and timely entry of medical supplies. And we need to make sure that the implementation of international human rights laws are abided by and followed so that we can get this aid in. We need to strengthen local capacity. People have not had to deal with a response of this magnitude. The capacities are not local. We need to build that into local organizations and local partners. Donor flexibility, this is a key for any donors that are joining us today. You know, we're in the middle of an active war, and it just sometimes makes me want to pull my hair when donors are asking for documentation and receipts, and you know, and the receipts could be a handwritten receipt on a piece of paper that is photographed and we take in, and then we have to justify why it's done that way. It's a war, there's no receipts, there's no laptops, so we just need to be a little bit flexible in this. Coordination with key stakeholders, supporting the cluster, the humanitarian aid mechanism is a must. We need to work through the clusters. This is really important. The health cluster that is coordinating a lot of this effort. We are a partner, we're a member of the health cluster, and we do that. And then looking at how we can look at the documentation in a way that makes it easy for our team on the staff to do so. I'll stop there. I'm sorry I didn't go through all the slides, but I hope that the slides will be shared and you find the information useful.
Thank you very much. Well, thank you, Sandra. We would like to have your recommendations in brief, because at the end of all the breakout sessions, we have to present these recommendations for the plenary session at the main hall. Our next speaker is Mr. Adib Shweki. My friend Adib from United States. Mr. Adib is co-founder of Rahma Worldwide, and he is the vice president. Mr. Adib, before joining Rahma, he has been in business, but actually he is leaving his business and spending all his time to help the people of Gaza. He has a bachelor's degree in business management from Connecticut University, and his networking skills helped Rahma Relief in expanding its aid partners from all over the world. He oversees all aspects of operation and business development in Turkey, Gaza, Kenya, Yemen, Lebanon, and Jordan offices. But now, He has been going to Gaza in and out many times during this war. We will listen to Mr. Adib Shweke, please.
Assalamu alaikum. Thank you, Dr. Fawzi. Thank you, everyone. It's really a great honor for me to be with you in this beautiful conference representing Rahma Worldwide. Of course, I would like to give you some background about our organization. Rahma Worldwide, it's a US NGO, was established in 2014. We start in Syria, so we have some background and experience about crisis. In 2014, and we entered Gaza the first, it was 2016, 2017. So we've known Gaza and we worked in Gaza before the war and during the 22 war. But unfortunately, what we're seeing over here now, it's the disaster for the century. So we thank all the organization who's been working really hard in Gaza. And I'm here really not to talk only about the organization. I'm here to talk about my experience and Rahma experience inside Gaza. Of course, if we need the numbers, I can talk about our work in Kenya and Syria, so on and so forth, but we're here for Gaza. And the main thing, I'm not gonna go through the slideshow, but the main thing I would like to give you my experience about getting aid into Gaza, really fast aid, and what we're facing of the obstacle, what's the challenges, and what I think from my own experience, we should be working to get over these challenges. Now, recently, before the invasion or the closure of Rafah crossing, we had great experience with the Egyptian. We were getting aid easily. We were getting many of our doctors easily with numbers. But right now, going through the other side, which is the King Hussein Bridge, that's what we're noticed that it's easy said than done. Of course, challenges will be facing that. The number of the doctors which we're trying to bring in to ease the burden of the Gazan doctors, it's being reduced. We bring in 10 to 15. It takes them 2 to 3 weeks, Kogats and Shapak, unfortunately, which now we have to go through them. And at the end, 24 hours prior to them on Tuesdays or Thursdays, they say, you know what, this has been refused. And can you imagine a doctor in the US coming all the way from the US, he's gonna have to close his, and they're asking for 1 month. And that's something really, it's beyond belief. So we're facing this issue. On the other hand, a lot of organizations, they've been asking us to help. The fact we have, direct contact with Kogat since even before the war, they're asking us to provide some equipment in. We were successful to get many of them. The last one, it was, the Kuwaiti Red Crescent for the field hospital, which right now it's operating with the help of the Palestinian Red Crescent. But since then, it's getting harder and harder. I mean, we send the request, it takes them 2 to 3 weeks. And at the end, they expand the dual use list, and go figure. How can you manage to have, last request, we applied for a portable toilet. Imagine, they say this is dual use. This is silly. So what I'm trying to have basically everyone help us with our campaign, with COGAT, with CLA, have the government, whoever has contact with those entities, to try to reduce that time for the dual use items to be reduced, because it's been expanding day after day after day. And we all need this list to be reduced basically, and the time. Imagine for the solar panel, one of the organizations asking us to get the solar panel approval, we send the request a month and a half, and it's only, they allow you to go with 550 volt, but if it's 650, it's not gonna work. Same thing with the generation. The generator, for the hospital, they're only allowing less than 30 kVA, which is basically, that's what we're gonna try to campaign with the authority, through the WHO, through the UN agencies, to have this list reduced with the numbers, and at the same time, the request time to be reduced and make it a little more bureaucracy to be able to help the people. The people of Gaza, as far as I'm concerned, they're gonna need help for years to come. So if we continue with this pattern, that's going to be a while for us to be able to make a difference. Are we making an impact? Of course we are, but we need much more cooperation and much more help from all the entities from all the organization who's been sitting here. Right now, as we all know, we have 3 routes. Thank God we're able to reestablish the entry from the Egyptian through the ERC. Of course, it's a long process. We've been getting all the, we got 2 shipments of medical supplies from Egypt 2-3 weeks ago to the Kuwaiti hospitals, and we've been getting regularly 10 trucks on weekly basis through Egypt. Of course, that takes a lot of coordination on the other side. It takes coordination for, for the Israeli to allow it, and it's being shipped on regularly. And I echo Sandra when she said that the meet was supposed to go on Sunday. We had the same issue, as a matter of fact, last Sunday. So we had to send them back, and that's more costly. We have to pay more money for, the truckers, and so on and so forth. The other route, which it's been very successful, and I think I will encourage all organizations really to look into it. It has 2 aims. Number 1, getting the supplies and food and medical supplies, medication from the West Bank. Number 1, we are moving the economy of the West Bank. I had a meeting with the Minister of Social Affairs in Dr. Samah, as a matter of fact, and we've been able to purchase really large amount of food and frozen meat from West Bank and get it through within 48 hours. I think this is going to be the future of the assistance, because going through from Egypt, it's doable, but there are a lot of obstacles. So, but going through the West Bank, it seems like it's much easier. Even medication, there is no restriction on medication, by the way. There are some restriction on just the equipment. It needs an extra examination. Is it doable? Yes, it is, but it will take time. So let's all of us get together and try to help the people of Gaza, I think, through this shorter route, which is basically the West Bank through Zakim. It's easy we'll do the coordination through Tarkumia. From Tarkumia goes up to Karam Abu Salim. From Karam Abu Salim, it goes either way, whether we unload in the south and we unload in the north. With that, I would like to thank Dr. Fawzi again for having us here and letting us speak our experience with the all organization. And Rahma Worldwide is going to expand their work, inshallah, in the next few months. That's correct. That's part of our ambulances. As a matter of fact, we were able to get 6 ambulances a couple of weeks ago, and now I'm working on 9 more. And that's all through Egypt. It takes a lot of work, but with the help of the ERC, which they've been very helpful, and of course the coordination with the other side, we're going to try to I got approval for 16 of them and 35 dialysis machine too. That's our next step to renovate Nur al-Ka'bi in the north and Nasser Hospital, the dialysis unit. Thank you so much.
Thank you very much. Thank you, Adib, for what you have been doing, you and your colleagues at Rahma Worldwide. Now may I call on Dr. Marwan Hinnawi, Director of Planning and Programs and Volunteering Department at Jordan Hashemite Charity Organization, CHECO, since 2018. He holds PhD in Political Sciences and International Relationships. Before joining CHECO, he served with the United Nations humanitarian missions in different conflict zones, and he received many medals. Please, Marwan, تفضل.
صباح الخير. Good morning. Goedemorgen. I think this is in Dutch.
Before they start, can you just give the audience some information about JECO, because not many of them know it?
Actually, it's mentioned in the first and second slide.
Okay, okay. You want to ask Adib? Yes, of course.
Yeah, go ahead. Well, we do cooperate with them. As a matter of fact, we just delivered one medical supplies to the south yesterday for Ghana. I know Ghana. I know the guy.
But that's not problem. Once we get the slide out, then we can.
Oh, you are?
Somehow, yes.
Yeah, we do. We cooperate with them. Yesterday we had one shipment medical medication enter the south and Palanir, yeah, of course. Am I what? I'm an American, but not a doctor. Well, Syrian, don't call me American.
Yeah, so probably if there's other questions, probably to Sandra or to Adib until the presentation of Marwan starts.
What I was missing,
Maybe.
if you don't mind, what I was missing is that the way we can really contribute to either one of the organizations, but other ways of contribute, other than donations and other than money and so on, as people in the medical field, in the healthcare system, in the research, people who are living abroad, Palestinians or others, how can we contribute to such organizations?
Right.
Spread the word. I mean, you know what we do. Obviously, our Facebook, our website is available. I mean, spread the word. That's good. If you want to contribute, if you need any help, I'm not sure which organization you represent. I mean, again, we've been approached with many organizations to be able to deliver supplies. We never say no to them, actually. If you have any project, any medication needs to be delivered, any issue with equipment being delivered, we can go through the process through our, contact and try to help you out, bring it in.
Yeah.
I'll give you my card now, but then
I would echo that. I would echo that and really advocate to push what was mentioned this morning about journalism, about getting journalists in to tell the story. That's really important. Speaking up about what's happening. People think that this feeling of helplessness is strong, right? People don't feel like there's anything that they're doing, but the words that are the demonstrations, the sharing has made an impact. I really believe that the change of the presidential nominee was really largely due to all the pressure that was happening on the ground. So I think that it's important to realize that your voice is very strong. As organizations, technical experts, there's a lot of local organizations, there's a lot of international organizations that could use volunteers for assessments, for program design, for studies. That's also a way that you can support local and organizations that are working on the ground.
Well, thank you. We have to stop here. So we listen to Marwan and then we will go back to the discussion. So we want to hear from you, actually. Marwan.
شكرا دكتور. صباح الخير. Good morning. First of all, KIT Institute, Gaza Health Initiative, thank you very much for such important conference, and thank you indeed for giving me this opportunity to present Jordan Hashimat Charity Organization to speak before such distinguished people. So thank you one more time. Jordan Hashimat Charity Organization. Next slide, please. So Jordan Hashimat was established in 1990 upon a royal decree. However, it's not for profit and it's non-governmental organization. Our, let's say, slogan is we consider ourselves as the humanitarian ambassador and the charity arm of the Jordan and all, let's say, charitable entities in Jordan and even outside Jordan who approach Jordan and who approach Jordan Hashimat Charity Organization to help and assist them in sending aid to conflict area, whether it's a natural conflict or a human-made. Since the establishment of Jordan Hashimat Charity Organization, we reached more than 50 countries. And then when we talk about Palestine, it's our twin, it's in our heart. And all the time there is directives from His Majesty the King not to save any effort and not to stop the assistance sending to Gaza and Palestine. So even before October 2023, we used to send convoys to Gaza and West Bank almost every week or every second week, and even to Jerusalem. And we used also to implement projects inside Gaza and West Bank through our partners, I mean, local CPOs, Palestinian CPOs, and I myself, I went to Gaza and West Bank many times, and we implemented many times a sustainable project and winter project, food project inside Gaza, West Bank, and Jerusalem. Gaza, let's say after October the 7th, there was only, at the beginning, only one route, which was the Al Arish route. And then 53 airlifts were dispatched from Jordan to Al Arish, and it was not from Jordan Hashemite Charter Organization. It was sent through Jordan Hashemite Charter Organization, but it was donated and in partnership with many UN agencies, INGOs, local partners, let's say civil societies in Jordan, and even individuals inside Jordan. So 53 airlifts, and then I have the chance to be on board of the first airlift that landed at Al Arish, and then the donor that time was UNRWA. Airlifts was to Al Arish, and then from Al Arish to Rafah. So we focus on the southern part of Gaza. So, and because there was limited access from the south to the north, and still, and upon, let's say, a royal decree and directives by His Majesty the King, we carried out the airdrops. So after the airlifts, we start with 85 airdrops in cooperation and partnership with the Jordan Air Forces. I know the one before, please. So, and then when we use the airlifts and the airdrops, there was no inland route is open. So once the inland route is open, immediately we seize this opportunity, and then we sent 3,414 trucks, and this is up to date, up to the 10th of September. So 3,414 trucks, it's composed of medical, relief, and food items. And also it is in partnership with UN agencies, INGOs, local partners, individuals from inside Jordan. And we also have a great partnership with the WFP Logi Cluster, and more than half of these trucks were loaded on military trucks. After or during Gaza crisis, we as JCO, we signed more than 50 agreements with UN agencies, INGOs, and then this donation that we mentioned earlier, it's funded, donated by the INGOs and UN agencies that I mentioned. Please, next. Because this conference is focusing on the health, let's say, crisis inside Gaza, I just would like to bring to your good attention that we sent to Gaza since October 2023 more than 2,378 medical aids, I mean, in the form of pallets to Gaza. And that was sent on air, either airdrop or airlift. And then the first airdrop was carried a medicine and medical consumables to the Jordan Field Hospital in the north, because at that time we have an appeal from the Jordan Field Hospital that if we don't send them medicine and medical consumable, they cannot serve or cannot help people. So the first, let's say, airdrop was on the north to help the Jordan Field Hospital to carry out their services. 2,737 inland shipment. This is equal to 137 trucks. This is, we mentioned about health only. And then 9 out of 11 shipping containers customs cleared through JCO. So we received 11 let's say, containers. Out of them, 9 were in relation to medical and were dispatched to Gaza. Customs clearance, because Sandra mentioned about customs clearance. By the way, Jacob, we enjoyed customs exemption and tax exemption. Therefore, we can help in importing any, let's say, aid, whether medical relief or food items from even outside Jordan. We can help with the clearance because we do have the customs exemption. And then we do have many warehouses we can store. And then we can also manage dispatching the aid from Jordan to Gaza. Next, please. This is some statistics up to the 10th of September about the, let's say, health statistics in Gaza. So this is the number of martyrs, 41,020 martyrs, and this is how many of them male, female, and children, and then total of injured, how many with moderate injuries, severe and minor injuries. And then here we have number of damaged ambulances, 186, damaged of medical facilities, 220, and number of hospitals out of service, 24 out of 37. And then the rest, I mean, the 10 or the 11 are partially function. Next, please. This is, I tried to summarize the obstacles. Is the crossing border closure. Nowadays, we know that Rafah is closed. Camp Shalom is partially open. Before, we used to send it through Zakim. Now Zakim is closed. Nowadays, we are sending it through Ares. So every time one crossing point is open and the other one is closed, and then each crossing point has its own, let's say, SOP or criteria, although it's not clear. And then we have lacks of access to the north. Since almost 2 months, the Rafah crossing point is closed, so we are sending only to Zakim and Ares. We have actually, inside Gaza, we have restriction of movement from the north to the south or from south to the north. I hope if we can send to the north, and then people or humanitarian workers can send the aid to the south and vice versa. But actually, what we send to the north is staying in the north. What we send to the south is staying in the south because there is restriction of movement. And then I think we have here a video. It's a 1-minute video that can summarize all what I have said. This is the airdrop.
Maybe we could pause it for the sound.
I'm not sure if it's from the source. This is our warehouses. This is inside Gaza. Just one more thing, that there is no more screening at King Hussein Bridge or at Alembi when we are using the Jordan humanitarian corridor, because we are sending aid on military trucks. So the screening is only carried in Amman, and then the trucks move from Amman directly to Zakim. So there is no stop at the borders for screening. It's door to door only. And then some organization, they organize themselves back to back. But it has nothing to do with the authorities, nothing to do with the WFP Logo Cluster, nothing to do with the JAF, nothing to do with Jordan Hashemite Charter Organization.
Thank you very much, Marwan. Please. Wait. We will open discussion after we listen to Dr. Uthman Asmadi. Dr. Uthman, he is Associate Professor at the Hashemite University in Jordan. He is actually a biomedical engineer. He has his PhD in biomedical from Montreal, Canada. He has been to Gaza as the first biomedical engineer, and he managed to re-establish the services in some of the medical equipment which has not been functioning, and he is now continuously in direct communication with the teams in Gaza, particularly in medical equipment and supplies. تفضل عثمان.
Good morning, everybody. First of all, I would like to thank DHI for the kind invitation. I would like to thank Noenika for the great effort that she had made to come up with this great session, actually, with the great speakers. I will talk differently because I'm working on a voluntary basis. I've been in Gaza in mid of April till early May. And since then, I'm heavily involved in Gaza medical sector in different parts, as we're going to see in the coming slides. Actually, I just, with intention, put this image. Yesterday midnight, we were working on Gaza European Hospital, fixing the CT machine. And this guy is an engineer, Abdul Qadir Al-Rigib, from Gaza Engineering Department in MOH. Guys like Abdul Qadir keep you always attached to Gaza and the cause. He's living in Al-Mawasi in a refugee camp with his family. But yesterday, he decided to stay in the hospital in order to fix the CT machine with online support from different engineers in Jordan. So guys with dedication like this, with hope that they carry every day with a big smile on their faces, deserve to be with them and support them. Cornerstone in our work. Actually, we spoke a lot about goods, about medical supplies, medicine, shipping, convoys, but we never spoke about people inside Gaza. So if you want to succeed, I think the magic word is Gazan people. So those guys has a great potential, very professional, knowledgeable, skilled in different means on social part and also on technical parts. So if you want to succeed again, we need to start from there, from people inside Gaza, working with people inside Gaza. And these images, I took it where in April, mid-April, when I was there in Gaza, and most of them are Gazan. And unfortunately, some of them are not with us anymore. So this is a part of the sad story. When you work with Gazan people, you need to expect that you wake up every day and knowing that some of your close friends and brothers and sisters are no more contacting you, reaching out to you, asking you for support or help, or having even sometimes social talks, and not only in business. This image is very important specifically for me and the team that I'm working with. Since beginning of the war till June, we were not able to get infographics like this. So what we have done, basically, we start looking to data availability, and we realized that there is a chaos world in terms of data availability. Every organization gives us different numbers about the situation inside Gaza, and we realized that this data need more verification and validation, and simply because till June we never had an online inventory system for Ministry of Health in Gaza, and this is what I've decided to start working on when I came back from Gaza, trying to revive the online inventory system, and thanks to Allah that we were able to reach to this point where we have a real-time data about medicine and medical consumables. But unfortunately, again, we realized that if you look to these two images, and I'm asking you to see the difference. Unfortunately, this image statistics from July, and this is from August, and you see we have no differences. And I think the statistic that you showed, starting from June, July, August, shipments from your side, like example, from your organization, was not really that much. Next slide, please. Again, what I have done, I started collecting the data from engineering sector in MOH. So we start with a very simple Google form. Sometimes you didn't need to have a sophisticated websites and data entry stuff. Google Forms were very helpful for us. We initiated this Google form and we asked all the engineers in all hospitals in north and south of Gaza to start filling these forms, asking for spare parts, maintenance requests. And at the same time, we formed another team in Jordan for online support, because unfortunately, many of the skilled engineers in Gaza, first of all, the companies are not working anymore. Most of the engineers are not very close to the hospitals, or they are martyrs, or they are displaced or evacuated outside Gaza. So we have few of them left inside Gaza. So we start the online support for them. Next slide. This is just last week. We received around 441 order for spare parts and maintenance, and almost all of them have been fulfilled. And because of that, we started with 0 CT modalities working in Gaza, and now we have 7 of them are working, even if they are very old, but 7 of them are working in the north and the south. And that was successful because we had the data, the real needs that they have. So, and sometimes you will be surprised that you need only to upgrade the software for the system to work. So you don't need even a lot of effort and magic and spare parts. And as I said, we have now 7 machines are working across Gaza. Next slide, please. So again, this Google form, we had the time to develop it and to have a website for online orders. What we have done in engineering, we have done it in medicine and medical supplies, but now we have a nice system with the approval part. So all the people in the hospital, in the pharmacy department, in the engineering department, making their orders, but they will pass to approval system where we have the directors with the formed committees, again, from people inside Gaza and outside Gaza, decide about the priorities and about the real needs, because sometimes some hospitals, they don't have anything in the stock, but the central warehouses have it. So by this way, we are sure that we get to the real needs of Gaza in terms of medicine and medical supplies and spare parts for medical equipment. Next. This is our very simple, again, website link. As you see, starting from June, we are updating. This is the medicine list. This is one example of the data that we have. So the medicine is divided into different categories. And once you click on any category, you're going to see the real needs at this moment for medicine inside Gaza. So for surgery, ICU, for mental health, for primary health care, all of the needs, and these needs are updated on daily basis. So we have a team working again with Gazan people. Whenever we have shipments arrive to MOH, this shipment is going directly to inventory system, and this is taken away from the need that you have. And every month we have a new report as the infograph that you are seeing. Next. Again, I will send it to you. It is a very simple Linktree website. It is yeah, the previous one, the previous slide. Yeah. So what you see is a simple spreadsheet, again on Google account. So based on the inventory system, by the way, the online inventory system that they used to have it in Gaza, they now have it again. We uploaded this system on cloud, and it's working now across Gaza in the north and the south. We almost did the stock taking, the inventory for almost 90% of the stuff inside the warehouses. So we are a bit definite about the real needs and the amounts that they needed. And what they do usually every month, they do a forecasting for the coming month, because you know the forecasting is very difficult nowadays based on the events, the number of casualties, the diseases that are spreading around. So the needs are not that like before. Before they used even to have an equation for forecasting. Now we have changed this equation for a new and different way of forecasting the needs for the coming 3 months, actually. Next. And this link, by the way, is open to everybody. So we'll try to spread this link and for anyone to need it. We started with the engineering team, and we have now 6 functional teams on the ground inside Gaza: engineering, medicine, medical consumables, medical laboratories, implants, and radiology. Next. So in order to get the data availability is very important and crucial thing, and we have to start from it and then end in it, because once you supply it, you need to see the impact on the ground. So you start, first of all, goals determination. Exactly what do you want to do? Are you looking for medical equipment, maintenance, data collection, data analysis, procurement, decision making, and logistics? All these parts has teams working on it. So we have a separate teams working on all these goals to really make a real need assessment, and accurate one, and trusted one that organization can consider when they're gonna work on the ground. Teams formations. Again, based on our goals, we formed 6 different teams. What's important? Incentives. Again, these teams, we need a sustainable mode for this. You can't form a team and this team leave it alone, just asking him to do tasks and tasks and tasks without any support, financial and emotional support. So incentives is a crucial part. I think all organizations have this challenge for them, for their workers. So we have the same challenge. So we try to just pay attention to this part, and we have almost 50 guys working with us from MOH, and I'm stressing on this point. We are working with directors of all departments in MOH, so we are not working with individuals outside the scene. And this is facilitate the process and accelerate getting all the data and the tools. We've sent different laptops, smartphones with eSIMs, iPads for inventory, and we were successful in this. We covered all the hospitals, all the warehouses around Gaza. So this hard work has to have a fruit, and one of the fruit that we have, we gained the trust, at least again, among local Jordan communities. We were successful to collect around $1 million shipments, a convoy of 10 trucks that JECO is trying to help us to send it to the south, because south is in very immense needs since 3-4 months. And we are collaborating with Specialty Hospital and Dr. Hamouri. They are providing us logistic support. We are using their warehouses and also generous donations as well. Without their support, we were not able to complete this mission. JECO, their help is great in different ways, in different means, not only logistics, but also inside Jordan on the ground. We were successful to make 2 blood drives. We are preparing to the 3rd one. With JECO, we were the first who are reaching the people in Gaza with the blood unit donations from Jordan. And Rahma as well helped us in this part, and they had the blood drive in West Bank with Ministry of Health in Ramallah. And finally, I would like to thank you for this chance. Thanks a lot.
Thank you, Uthman. We have some time for questions. Please, Dr. Muhammad.
My name is Dr. Muhammad Abdelhadi. I am a cardiologist in Germany and head of the Jordanian German Medical Association, that is a gathering of the Jordanian doctors in Germany and so on. We have heard enormous efforts from many parts here, but during this discussion, I have noticed, for example, that one of the biggest aid authorities is facing difficulties that the other institute, organization is not facing and has a very good solution for that. And we heard also about doubling the same needs. So you get a request and two different organizations are going to answer for that request. So one answer is too much because the other one has did the job. My appeal, this is the third conference for Gaza Health Efforts Initiative. Can we today go out of this conference agreeing to have a platform for all the organization, open for everybody? Somebody who want to collaborate together, others want to be just separate from each other for many reasons. There are legal reasons, there are personal reasons, whatever. But to collaborate, to organize this in a one platform. Jordan, for example, has unified the efforts within Jordan by law through making all the efforts go through the JECO. So this has been done in Jordan. Not all the efforts are going through Jordan. So there are efforts going through Egypt, through Israel, through other parts of the world. So if we go out today, that all the organizations that are taking part today might agree on establishing a platform. We are outside of Gaza, we are in Jordan. There are many experts in IT, in internet, in making homepages, in making all these platforms available. You have programmers in America, you have programmers in Europe. We can actually make the efforts outside Gaza so organized that we will avoid these troubles that we have. If somebody knows something, I will say one word in Arabic, الدال على الخير كفاعله. So if you help somebody to do something good, it is just like you have made that same thing happen. Thank you.
Thank you very much. Yeah. تفضل. Yes, please. Please. Will you introduce yourself first?
I'm Jackson. I work with Med Global. We were one of the first organizations in Egypt with Panera and Rahma to start a coalition of NGOs called the Humanitarian Emergency Response Coalition, through which we share information and coordinate internally on the information that we're receiving inside, but it's all private. So the offer to make a platform to somehow make this information more public or more accessible to other people who want to get involved, I think is a brilliant idea. And we have the organizations that are doing the work on the ground working together. The question is, how do we connect that with the wider outside audience? So I'd love to follow up with you individually. I'd love to invite you to one of our coalition meetings with Panera and Rahma, along with many of our other partners, but I think it's an excellent idea.
Well, actually, from the first conference and the second conference and this conference, people are meeting each other and collaborating. And you had an example. Dr. Muhammad, he is the chairman of Jordanian doctors in Germany. And Dr. Hussein, where is he? Maybe he's in another session. He is the president of the Palestinian physicians in Germany. and they are both working in the same hospital, in the same city, and they met in Amsterdam. So now, JARMED and the Palestinian organization, they can collaborate, and we are here to bring people together. This is what GHI is. Actually, we had our friends from Khidmat from Pakistan. They are with us today. They have 60 containers of medical supplies sitting in Kashmir. Yeah? When they heard about us, we introduced them to JECO, and now the supplies are getting into Gaza. So this is how we can do, but we cannot force people to work together. We introduce people to each other. If they want to collaborate, that would be good. And this is the main idea, that to organize our efforts. This will make resources used better, because we don't want to duplicate our efforts. We want to utilize the limited resources. The demand in Gaza is huge. It is huge. So whatever resources we have, we must use it in the best possible way. And where it goes, we don't mind. Through the West Bank, through Jordan, through Egypt, wherever. The people in Gaza, they need it. Athman.
Rahma is offering to help from West Bank and Egypt. DECO is doing a great job in Jordan, but still we are talking about capacity. Rahma has a limited capacity, so if all of us for a sudden goes to Rahma, Rahma will not be able to fulfill our needs, because even Rahma has a limited capacity from the Israeli side. So they have limited convoys. Like in Jordan, we have around 40 trucks to 50 trucks every convoy, but almost twice to 3 times a week. But we are talking about Rahma, they have a bit less number of trucks that can move together in one day.
I don't know, can we open discussion?
It is open.
Yeah, the issue is we're facing, frankly, especially from the Jordanian, not Jor- I mean, the Egyptian corridor, as Sandra had mentioned, is the security issue. Now, we have capacity to get like 10 or 15 trucks. We have to coordinate, obviously, with the Israelis for them to go from, through Salah ad-Din and get there. WFP, we're trying to fight with them to expand the fence road. The fence road has many restrictions, frankly, because whoever drives on the fence road has to be cleared by the Israelis. And so we are unable to do it. The only way, if it's going to come to the south, is to go through Salah ad-Din from Karam Shalom down to Gaza. And that's very costly. I mean, Sandra had mentioned that $3,000, that just for the thieves to protect the thieves. And this is unbelievable, seriously. I mean, for us to get the meat like in, we need a security. We made him $3,000 on top of it, $1,200 for the truck to go up. So I was talking to Brother Marwan over here regarding having some of those shipments coming to the south. I told him I have capacity for 10. I can take 10 unless we have the WFP take it through Kazafil or through the fence road, which is gate 96.
Yeah.
We can, I think Sandra, you know exactly what I'm talking about, because you are involved with the WFP, but they're not expanding the capacity of them. That would be a great idea, especially talking 1.6 million people in the south. In the north would be getting aids very easily, but we are facing the issue with increasing the capacity. I think there will be some solution next week. I'm trying to meet someone. You're smiling, so I guess you know what I'm talking about. So hopefully, but again, the main issue we're facing is the capacity and the high cost of the security. So Marwan, if you want to get 20 or 30, I mean, to the south, again, I can take them 10 at a time. It's fine with me. But to have
Yes, yes.
20 together, go ahead, Sandra, I'm sorry.
Yeah, Sandra, please.
No, I just want to respond to that. There's two things in terms of the security that we have to push for. One is the blue police. There's no security forces on the ground. And the other thing is we have to flood Gaza with humanitarian aid. And the issue is not WFP or other organizations. The issue is Israel. Israel, if you look at the numbers, if you look at the truck clusters, they have kept the trucks at a steady about 100 trucks per day. Might go to 140, then you'll have 60, then you'll have 80, then it'll go at maybe the highest they had is 200, but it is a strategy to keep the numbers at a very low number, and people are desperate, people are hungry, and what people are starting to realize is the South is now like the North. There are cases of starvation, there are cases of death by starvation, the number of diseases and illnesses caused by lack of food and nutrition nutrition is on the rise. So flooding.
You know what their argument
You
is?
mean-
Their argument is, I'm sorry, I'm not trying. Their argument is, okay, we have like over 3,000 pallets at Karam Shalom. Nobody's claiming it. Organizations are not claiming it, not because they're on the Palestinian side. I've been there, I saw them with my own eyes. They're saying that whatever is there, it's not claimed because they're afraid of the, I'm talking about United Nations, UN agencies, because the security when
Yes.
it comes. So I think the major part is the thieves, which is basically they wait at the, of the way from Karam Shalom down to Gaza, and that's what preventing us. We can, as an organization, American organization, but we're not international. Actually, we're not United Nations. We can hire armed guard, and we are doing it. Maybe I know you guys do.
No,
Well, I mean,
no, we don't hire armed guards.
Okay, Adib, تفضل. Andrew.
Hi, thanks. I'm Andy Ferguson from Ideals. We've been working with the Ministry of Health in Gaza since 2009, trying to help build capacity for trauma and limb reconstruction. I just want to build on something that you touched on with your slides, and that is that through until May, we could send a huge amount of equipment and supplies with our surgical teams when they went in through Rafah. So we had teams of 4 or 5 people, but they were taking 25 suitcases, and that was more than enough for our teams to work with during their deployment and to restock the supplies in the European hospital and Nasser hospital. It's completely turned around. Now, for a month's deployment, they can take 1 case and a small backpack in with them. So that is a point which needs to be highlighted. We're not hearing enough about that, and the increased restrictions since May. Our only route now is through Karam Shalom. And my second point is for Dr. Marwan, and it's a very selfish one. You mentioned that you've signed 50 agreements with INGOs since this began. Do you have any capacity to take on more? Because we badly need your help, and I'm sure other organizations do too.
Marwan.
Thank you indeed. We are willing to sign any number of agreement. We are ready to, let's say, to assist and to help any organization. And then the most important, that signing an agreement, it is not a condition to help you for sending aid to Gaza. So if you wanted to sign an agreement, we are ready. And if you don't want, this is not a condition not to help you. So we are ready to help you. And then one more thing, the obstacles of sending, let's say, a very little, although we are sending 2 to 3 convoys a week to Gaza, each convoy is composed of 40 to 60 trucks, but we do believe that it is very minimal. But the obstacles is from the other side. So Karam Shalom is open very slightly because of the obstacle from the other side. Rafah is closed because it's imposed by the other side. Zakim is closed now because of the other side. It is the capacity of receiving 2 convoys a week only, or 3 convoys, because it's an obstacle from the other side. We are willing, and I think our Ministry of Foreign Affairs, he said we are willing to send 500 trucks a day if the other side allowed to do so.
Thank you, Marwan. We have to finish. There was a question here, yes?
Thank you. It was a little bit more of a comment than a question, just in response to the discussion between Sandra from ANERA and Adib from Rahma. I mean, yes, I think that the Israelis are the root. And so here we are treating the symptoms, and I think that's fine. We have to treat the symptoms here. However, at the end of the day, why are people looting? Because security people get killed. Why is there a lack? Because the Israelis say no. If they were to let go of Egypt, then, like, we're now considering May to be like Ayyam al-Izz, right? Yeah, which is crazy when you think about it, because that was one of the worst periods of time until we got to the new worst period of time. And we're going to hit another time where we say, oh, don't you remember the beauty days when we used to get 50 trucks in a day? So I think we have to also, through all of our work, keep focusing on the root cause, keep thinking about ways to subvert the occupation, to subvert the Israelis, which are the one and only enemy of the Palestinian people at the moment, that we all have to coordinate against here.
Thank you very much. Yes. Totally agree. Othman, you have 1 minute.
Just I want to Based on a point, I wish that we can consider it as a recommendation, because we did not speak about blockade between the north and the south. And this is very crucial. Like in Jordan, they are able to deliver 120 truck every week, but none of them goes to the south. Like example, assets for dialysis machines, they've been in the north since 3 months. They are now expired. Around 200,000 of money is wasted because we are not able to move stuff from north to the south. Tents, we moved with our partners 3,000 tent to the north, dedicated to the south. We are not able to move it. 2 weeks ago, we shipped with JACO for the first time a cold chain with some reagents for medical laboratories. Tacrolimus, like specifically we're talking about, tacrolimus is a reagent for kidney failure patients. It took us 2 weeks to send a 1 cartridge with like very, very small, tiny one. 2 weeks with coordination with WHO. Every day we coordinate and then the coordination is canceled. Yesterday we succeeded to send this cartridge, tacrolimus. And this, everyone knows about tacrolimus is a life-saving reagent. Like patients need to rebalance the doses for dialysis machines. So this is very critical. I wish that we can address this issue, the blockade between the north and the south. It's not only the borders, but within Gaza, medicine is not allowed to move between the north and the south.
Yes, well, this was obvious when the slides that I started with, that the supply of essential medicine in the south is much worse than in the north. And this is the reason why, because there is no movement of goods between the south and the north. Last question, and I have to finish. You know, we have a lunch.
Sure. I'll be very quick. Thank you for all the speakers, but my question is, I mean, I know we've managed to capture the needs in Gaza, and we're talking about safety corridors. One question, I think, are there any efforts to map the local partners who are willing and capable to implement interventions? Because especially when we move towards fundraising and resource mobilization efforts, I mean, we've heard people talking about, you know, commodities being transported but not claimed by anyone, and this is going to be a serious concern for all the donors and the international community. So this is a recommendation, possibly could be coordinated through the GHI, continuous mapping of local partners, because I know everyone is there. We don't, and based on what Dr. Mustafa was saying, we're not looking to duplicate or reinvent the wheel, but everything is so fast changing. Someone who's functional today might not be functional tomorrow. We want to work through the ministry, we want to work through the local NGOs, but we need updates on who's functional and who's not and what resources are there. And this is maybe something that could be on the portal that was recommended, or maybe through the initiative. Thank you.
Well, it's obvious that so many of you suggested this, and I think that the platform, whether on the needs or the demands or the supply part, you added something else now, that you want to add the local partners, which is important. Thank you very much. We have to finish.
Nobody talked from GCC. So yes, Hashim al-Hashmi from Kuwait Medical Association. Allah Yaslamik. You know, just I was thinking how we can move during the current situation, and obviously, you know, whatever is going in is decided by the occupation government, and this maybe will cover less than 10% of the needs. That's why one important point here, that we have to choose what go in. At least, you know, this should be an important part of coordination. So if we have a limited amount of medical aids going in, then we have to know what's going in and make sure that this is the priority.
What we have shown is the essential medical list, which is requested by the Ministry of Health in Gaza. So this is what we are talking about. So we're not talking about luxury medicine. So I would like to thank you all. I would like to thank our speakers. Monica, thank you very much for your efforts. Thank you very much for being with us. So it is lunchtime. We have a break for about 40 minutes. Thank you.
هلا صورة جوازك وتستلم جوازك.
شكرا.
يعطيك العافية دكتور. ضل هلا بس مشان تستلموا جوازاتكم بدكم توقعوا على صور الجوازات فوق مع النوتري بالقاعة بالهاي، بس مشان ما قبلتش حتى تتغدى حاولت انه اخرها مشان هذا قلت لي I have to go back to the office
دارين بدي تتعاوني انت وعثمان ونيكا حضرونا كم سلايد